What are the symptoms of narcissistic personality disorder? Narcissism is a label that gets thrown around a lot, especially when someone seems conceited or acts out of self-interest, says psychologist Christina Hallett, Ph.D., ABPP, Associate Professor of Graduate Psychology and the Director of Clinical Training at Bay Path University in Connecticut. But a narcissistic action every now and then isn't the same as having a personality disorder. With the latter, a narcissist's self-absorbed and self-centered way of thinking and behaving surfaces in every area of their life, from work and friendships to family and love relationships. The 9 most common traits for NPD include: 1. Having an inflated sense of self-importance and entitlement. Deep down, you feel like you're the best, most successful, competent, insert praise here, in any situation. 2. Needing constant admiration. Your self-esteem is like a balloon without a knot, requiring a steady stream of attention, approval, and recognition to keep it inflated. No matter how much someone tells you that they love or look up to you, it feels like it's never enough. 3. Expecting special treatment. Whether it's favors or apologies, whatever you want, you believe you deserve to have it, because you're superior to everyone around you, and they know it and should comply. 4. Exaggerating achievements and talents. You have no problem embellishing the facts, or even outright lying, about your life, resume, and experiences. 5. Reacting negatively to criticism. Even though you crave control and take full credit when things are going well, you're quick to blame others whenever a situation doesn't go as planned. It's extremely hard to accept criticism or admit to mistakes because, naturally, it's always someone else's fault, not yours. 6. Being preoccupied with fantasies about power, success, and beauty. You tend to create and believe exaggerated, unrealistic narratives around your success, relationships, even how good you look to help you feel special and in control. Anything that threatens the fantasy is rationalized away or simply ignored. You also want people to feel envious of you, and you feel pretty envious of people who have what you want. 7. Taking advantage of others. You often don't think twice about using or exploiting other people to achieve your own ends, whether maliciously or obliviously. You care about your relationships and the people in your life on a superficial level, if they elevate your social status, or make you look or feel good, for instance, and you don't really think about how your behavior might affect them. 8. Having an inability or unwillingness to recognize the needs and feelings of others. You're super sensitive to how people treat you and react to your needs and feelings, but on the flip side, you can't put yourself in other people's shoes and empathize with their experiences. You might belittle others or even bully people to feel better about yourself. You never really go deep in any of your relationships, either, and, frankly, it doesn't bother you all that much. 9. Behaving in an arrogant manner. With an inflated ego and sense of superiority and entitlement, you probably insist on having the best everything. The best car, office, designer clothes, monopolize conversations, look down on people you perceive as inferior, and only associate with those you think are equally special, successful, and talented. How is narcissistic personality disorder diagnosed? NPD is not the kind of condition that can be diagnosed with a blood test, MRI, or exact scale, and according to the DSM-5, a person needs to exhibit only 55% of the above traits, symptoms, and behaviors to be considered narcissistic. But nailing down NPD can be a little more complicated. Since narcissists tend to think there's nothing wrong with them, they rarely enter treatment. This in part may explain why we might feel we know and encounter many narcissists, but only an estimated 5% of people actually have NPD. This is also why you can't ask your therapist to diagnose your narcissistic husband with the disorder if he doesn't think he has a problem. Narcissism hinges on personality traits alone, most of which are objectively negative. It's pretty easy to label someone with these tendencies as, well, a jerk. But psychologists want to be extremely careful about pathologizing someone's personality. A clinical NPD diagnosis is given to someone who's experiencing social and occupational impairment and subjective distress, which is a fancy way of saying that their narcissistic behavior is not only messing with their work and personal lives, but they're actually aware that it's destructive, and it's making them uncomfortable. In other words, if a self-entitled, grandiose, empathy-lacking person doesn't see a problem with the way they live their life, they're simply just a narcissist, full stop. A clinician usually won't diagnose a narcissist with NPD until they're struggling with their behavior and seek help to change it. These individuals most frequently come to therapy to either A. get support for their perspective, or B. because a family member is insisting and it's easier to comply, says Dr. Hallett. Sometimes, it takes facing a serious ultimatum, failure, or loss for someone with this personality type to get help, and it's not uncommon for them to seek treatment for another mental health problem altogether, like depression.